Hello. Hello, people. Oh boy. I feel like I look really kind of, oh my goodness, I'm like sweaty. What is happening? Okay. Blah. Sorry. I was not prepared for the shine. Um, so welcome to this live. I am going to talk career insights, answer any questions at all that you may have about nursing. So please feel free to pop those in the chat at any time. I want to make sure that this live is beneficial and helpful. So if you're thinking about nursing, if you're in a nursing program but not sure what you want to do, if you are in something like a specialty that you don't like, or you're curious about another specialty, in the last live I discussed my career journey, so I will not flesh that out again. But I can start out by fleshing out the different options for getting your nursing degree. And as anyone has any questions, I will field those. Okay. So let's say you are in high school and deciding you want to become a nurse. There are essentially 3 ways that you can do that. There's number one, or I guess, well, okay, hold on. Let's back up. There are multiple ways, many ways you can do that. You can become an LPN first and then complete an RN program, or you can go to and get your RN first. Okay, so there is a difference between an LPN and an RN. Okay, and a lot of it does depend on which state you're in. Different states allow LPNs to do different things. And it depends on what your career trajectory is and where you would want to be. If you want to work in a hospital in high acuity care, excuse me, you're going to have to be doing probably the RN situation. There are fewer LPNs. A lot of LPNs work in a home health, nursing home kind of situation, maybe even private nursing, that kind of thing. But if we're talking like hospital-based nursing, you will want to get a RN. And if you're thinking you ever want to get into management or leadership, you're probably going to need that or you are going to need that RN. And it comes down to differences in terms of like what you can physically do. Again, it depends on state. Sometimes you can can't give IV medications. Sometimes you can. It comes down to some nitty gritty skills and certain things. And you may, if you have LPNs, they may need to be supervised by an RN. So I am a fan. If you can afford it and have the time, I am more of a proponent for getting the RN degree. So hold on. There is a difference between an RN. There's not an RN degree. There's a nursing license, and then an associate's degree in nursing, and a bachelor's degree in nursing, master's and doctorate. Okay. So one of the most cost-effective ways to get your RN is to go through an associate's degree in nursing program. You may hear it abbreviated as ADN, associate's degree in nursing. So what that is you're going to a community college, a junior college, and that's where you're taking your courses. Those programs are typically about 2 years if you're going full-time and don't have to retake any courses. If you do graduate with some extra credits, that would help. But these programs are often very competitive. To get into them, you're going to have to do like the TEAS probably exam, TEAS, various entrance exams. They're going to want certain scores on things, because one of the things about nursing schools is they are judged based off of how many people that graduate their program pass the NCLEX. They do not want to admit anyone into their program that they don't think is capable of passing the NCLEX upon completion. So nursing schools at the bachelor's level and at the associate's degree level will be screening candidates pretty aggressively, because if they let people in that are not going to perform well on examinations and are not going to graduate, or are going to barely graduate and not be successful with the NCLEX, that looks bad on them. It's not really about like how many people can we get in the program. It's how many people, what's our graduation rate, what's our NCLEX pass rate. So if you're looking at a nursing school, those data points are required to be reported by the nursing school. So you can go to your state board of nursing's website, whatever state you're in. So you just Illinois State Board of Nursing, North Carolina State Board of Nursing, and you can look up the NCLEX pass rates for the nursing school that you're thinking about going to. You do need to kind of interpret these with understanding how many people were in the program. So, if there were 100 people who graduated, which would be a very large nursing school class, and 10 of them didn't pass the NCLEX, okay, that's 100 people, that's a lot of people. But if there's 10 people that graduate, like I graduated with only 16 people. That's not very much, right? So if just one person does not pass, that really throws off the percentage. So look at how many people graduated, what the percentage of people, the NCLEX pass rate, the graduation rate, because you want, and hopefully, I don't know if this is reported on those, but the job placement rate, maybe they'll say that on the website of the nursing school. But these are important things to know because you're paying a lot of money for this degree, and you're basically investing into an asset, which is your nursing degree and diploma to enable you to earn money later on. So I don't want you to invest any money into an asset that is not reliable. So if it's like a bad nursing school, I don't want you spending your time and money there. I want you to be prepared to pass the NCLEX, to graduate, and to get a job. Okay? So those are things, like not all nursing schools are created equal. Excuse me. There's also an aspect of accreditation. So you can graduate from a nursing school, but you also have to get approved by a state board of nursing to get a nursing license. Okay. So these are two different things. You could go through the school situation, but not qualify for a license and never work as a nurse. Okay. Because a registered nurse is registered with the state. Okay. The state and has a responsibility to the public to ensure that anyone who holds the nursing license title, and this is the same with any other profession with a regulatory body, physical therapists, physicians, pharmacists, massage therapists, these are all licensing boards or departments of professional regulation. They're the people that are saying, yes, you did what you were supposed to. You've passed a background check. You are safe from our perspective to be able to provide care for patients. Okay? Because you can't just give a nursing license to anybody, right? You could have someone go through nursing school, but let's say during nursing school, they developed a drug habit and an abuse situation and a child endangerment thing, and have all these criminal charges against them. That person should not get a nursing license. They just should not. They're not safe to be caring for patients. Okay. So I say all that to say, when your state looks at if they're going to give you a nursing license or not, they look to see, number one, if you pass a background check, and number two, if you graduated from an accredited institution. So accredited means we have set this specific standard of accreditation, of meaning like this is the minimum expectation of education that all nurses in this state need to meet. And you have to go through a process to prove that to an accrediting board. And this board will say, yes, this nursing school has met all of those standards. All of their professors have a certain level of education. The dean has a certain level of education. Their nursing program goes over this, and this. They use this. So there's all these things that ensure that the nursing school is teaching you the things they are supposed to, that is consistent with someone getting a degree in nursing. So the last thing that you want is to go to a nursing school that's not accredited, because if you go to a school that's not accredited, you can't get your license. Okay. Now, granted, there theoretically should not be nursing schools out there saying, yeah, come to our nursing school and we'll be able to teach you how to be a nurse and you can be a nurse, but we're not accredited. There needs to be disclosure there. So if I was looking for a nursing school, I would look at the NCLEX pass rates, I would look at the graduation rate, the job placement rate, and I would be looking at, are they accredited? And when is that accreditation due for renewal? Okay. Because maybe they're accredited, and accreditations, I don't know how many years they last. It's like 4 or 7 years. It's like a longer period of time. It might even be 8 years. I don't know. That might have changed. But if your school loses accreditation while you're in school and before you graduate, that is a massive problem because you would not be graduating from an accredited school. So that I've seen that happen where somebody is in nursing school and then their school loses the accreditation status. So, that is something I would be looking at. So you could look, and that's true for associate degrees and bachelor degrees in nursing. Here's a common question. If I graduate from an ADN program, an associate's degree program, do I take the same test, the same board examination as I do if I graduate with a bachelor's degree? The answer is yes. Okay. There is a different licensing exam if you graduate LPN school, but that is the same licensing exam if you graduate from an associate's degree program or a bachelor's degree program. Okay. So you might be asking yourself, well, why in the world would I get a bachelor's? Like, if it's more expensive and it takes longer and I take the same exam? That was a great question. So you could, like, the benefits of the bachelor's pathway, which is what I did, is that a lot of hospitals, especially highly competitive ones, or ones that are really good and in like large urban areas and research facilities and all of the like fancy hospitals want more bachelor's prepared nurses. And to be fair, I understand that perspective of like, when you look at the whole healthcare team, you're working with physicians who have a doctorate. You're working with physical therapists who have a doctorate, pharmacists who have a doctorate, and occupational therapists. They're pushing for it to be full. I think it is master's now. I don't know if they're going to go to the doctorate thing or not. I don't know if that's feasible for that field. But you're surrounded by people with terminal degrees. And I understand the perspective of like, okay, let's make sure all of our nurses have at least a bachelor's. As college has evolved and the actual value of all those other classes, that is another discussion, whether or not, but there is some data to show that nurses who have a bachelor's degree provide better overall outcomes or have better overall outcomes. I haven't looked at that data in a long time, but that's what I saw years ago. But if you have any desire to work beyond staff nursing, if you want to ever be in a manager role, an educator role, a remote role, maybe like any of these, like if you don't have a bachelor's, it essentially limits your flexibility within the degree. Okay. Or within the profession. So if you are someone who has time and you have financial flexibility to the point where it makes the most sense for you to just right out of high school or just do a full bachelor's, that's, I don't know. I mean, okay. I guess if I could do it all over again, which I mentioned in the last slide, but I would have graduated from high school. I would have done an ADN program, but I would have immediately gone back and done a BSN completion program. And that can be just much more cost effective because if you're doing that, you're not going to get the classic college experience of like living in a dorm and all that. That is overrated and not worth the thousands of dollars it puts you into debt. It's my opinion. But if, you're in a season of life and have this, financial flexibility where you're like, you know what, I could devote full time to this for 4 years and doing the bachelor straight out makes the most sense for me. Boom, do it. That's great. Because I do encourage people, if they do the ADN degree, to get the BSN. And even if you're like, oh, I'm not sure if I'm going to use it, like it all depends on the season of life too and what's going on in your life. I think that doing those things earlier when you are younger, have more time, more stamina, more flexibility. Maybe you don't have as many commitments, like maybe you don't have kids. Maybe you're not a full time caregiver for somebody, whether it's kids or a family member. Um, that doing that in your 20s can be much more feasible than doing that when you're like, okay, I got my ADN when I was 20 and now I'm 45 and I want to do something different, but before I can do something different, I have to go back to college. Like that's a tough pill to swallow. But there are a lot of great options out there online. Like there's a lot of competency-based options for BSN completion, a lot of that are online, and BSN completion is totally doable online. The ADN aspect of it is the hard work. I don't believe with BSN completion programs there are clinical hours. I think it's all like research classes and that kind of thing. So there's also a few other ways that you can become a nurse, though. And I've seen a lot of people do this. Let's say you were a very normal person and had no idea what you wanted to do when you went to college, and you got a degree in something else. You got a bachelor's in something else, but you're not using it. You don't want to use it, or I don't know, maybe it's a general degree, like maybe a biology degree, a psych degree, and you can't find work, or you don't know what you want to do with it. I went to high school with people and know people who went back to nursing school and they decided to do an accelerated BSN program. So what that is, it is a very challenging program. I believe it takes about 18 months. You have to have a bachelor's in some degree, like something. It doesn't have to be medical related, but you have to have a bachelor's degree. That's like entrance requirement, is having a successfully completed a bachelor's degree. Excuse me. So you can use that degree, get in this accelerated program, and in 18 months, but 18 months straight, not very much breaks for like holidays. There's no summer off. There's no spring break. This is like, you're not working. Like you don't have time to do this in a full-time job. It's all in person. It's a commitment. And you go through that, and then you can you get a bachelor's of BSN, and then you're eligible to sit for the NCLEX, provided it's accredited. And then at the end of it, you would be a BSN RN and whatever your bachelor's is. For people who already have a bachelor's, that is a very cost-effective way. Now, not everybody can afford to like stop everything and do that. I do know people who had a bachelor's, but then they decided to just get their ADN, and then did a BSN completion program. There's a lot of options out there. It gets confusing. And then there's a last option. It's called a direct entry master's degree. So that means that you're going into this program. Ooh, I can't remember what the requirement is for. I can't remember. You might need a bachelor's for direct entry master's. Ooh. I'm going to have to look that up, and I'll put it in the comments when I post this, whether or not that's true or not. But so this program, when you're done with it, you get a master's, not a bachelor's. So direct entry master's. So through the program, you are getting your NCLEX. So I think it's like they do something where like you take an NCLEX exam after the first 2 years or something. I don't know. And then you do another year or two, and then you have your RN, but then you're an MSN RN, which is what I have. I didn't do that route, but I have an MSN RN. So that opens you up for a lot more positions. If you have a master's degree, like management and leadership roles, you can, in certain states, you can work in the nursing school. You can be clinical instructor, like that kind of thing, and a lot of other jobs too. And so I know people who have done that too. And what's funny is, and I get it, there are old school nurses who are like, if you have a master's degree in something, you should be like really, really good at it. You shouldn't be able to do a direct entry master's into nursing, because you should have worked at the bedside as a nurse and then gone and gotten your master's. While I can understand that, I saw the amount of clinicals that these people have to do for the MSN, and at least the last time I looked, and it was ridiculous. Like, they got a lot of experience within the program, and it was a long program, and it's like, this person could have done an ADN and with all those clinicals and worked full time, except they're paying because they're paying to get their master's. Like, I mean, yeah, they're not doing like 312s, but they're getting a lot of clinical experience. And if you have someone who graduates with a bachelor's, but doesn't go into the hospital, maybe they go into public health nursing, or they go in to do something else, or a very specific non-hospital thing, and then they go into the hospital, they're going to need a lot of orientation anyway. So that's, oh my. So those are your ways that you can become a nurse. Okay. ADN, BSN, accelerated BSN, direct entry masters. Those. I've not gotten one question, y'all. Hello. I would love to hear who's here. Where, are we a nurse? Are we thinking about nursing? Do we hate nursing and we're rage watching this? Sometimes I get comments on videos. I'm like, are you rage watching videos because you hate nurses? Maybe that's what's happening. But I would love to hear about the questions or anything like that. Nursing is very challenging to understand as a profession. So I am working on some blog posts and like guides and things to help understand. Oh, good. Kenya. Did I say that right? Kenya. I probably did not say that right. Hello, fellow nurse. So I'm going to create some more guides and things. Okay, wait. How did you become a nurse? Keenan. Nice. What degree do you have? How did you become a nurse? Let's get a sample size here. So I did traditional BSN. She has ADN by the end of this semester in Texas. So this is interesting. Okay, BSN. Okay, wait, hold on. I'm confused. You get your ADN by the end of this semester in Texas. Oh, so this is somebody else. I'm so sorry. So you did a generic BSN. Hey, what's up? Me too. And then someone else will have their ADN by the end of this semester in Texas. Woohoo! So ADN. Wait, Crudette. Oh, applying for the BSN. Oh, cool. Now, how are you going about applying for a BSN to RN? How are you picking? Because my tip for that, if you have a job already. So when I was working at the hospital, the hospitals would have affiliate partnerships with the various universities because they wanted their nurses to have BSNs. And so if you were an employee at that hospital, you would get a discount on tuition. And a lot of the hospitals also had tuition reimbursement. So if it was like $15,000 normal, they would knock like $2,000 or $3,000 off. Oh, good. I'm so glad. They would knock a few thousand off in there, like, hey, you're an employee of this hospital that works with our university. And then the hospital, it would reimburse like $3,000 a year or something like that. So when you combine those things, that's pretty awesome. So my tip is, because you could be applying for jobs where you're like, oh, I'm sure they want a BSN. As long as you can speak to it very well in the interview and bring it up right away. You know, I know my short-term goal, other than becoming very competent in this role specifically, I am going to get my BSN very quickly. I'm going to get situated in this role, get comfortable. But as soon as I kind of get my feet wet and I feel comfortable with this role, I'm going to be applying to do my BSN completion, because that is very important to me. I am hoping to have it done by this X date. So speak to that in an interview and speak to it first. No rage watching. Good. Okay. And you can speak to that first. It like reassures Because if there's two candidates, one has an ADN and one has a BSN, and they're identical candidates pretty much. The hospital, depending on the hospital, may opt for the BSN. But if you can speak very well to, you interview well, and you can navigate the questions. I do have a resource for that. There's a link, I think, to all my job stuff in the description of this, I think. But if you can do a good interview and be able to just speak to that to give them reassurance, hey, I'm willing to sign something that says I will have a BSN by a certain date because it is that important to me. And you have like ownership and accountability of like, this is important to me. Because then that buys you time to get settled in the role, because I would not be starting a college course and starting my first nursing job ever at the same time. I would wait like 3 months. And then you can also get acclimated to the hospital, their policies. You can learn about the tuition reimbursement because there might be some stipulations and things you need to be aware of. And you can also look at the policy and see the amount. You can find out if there's any schools that they work with, because BSN completion, like, it's not like you need to pay a ton of money to the best BSN completion program ever. I would get an accredited one, but I wouldn't like pay 10 times as much to graduate from this like prestigious university with the BSN, because I've been a nurse a very long time. I never had a patient ask me how many times I took the NCLEX. I never had a patient actually ask me where I went to college. They're just like, "Oh, you're a nurse. I trust you." Like, that's basically how that all worked. So I'm excited for you. You're going to graduate so soon. That's very exciting. Now, okay, do you have an idea of what kind of nursing, or do you have a job already lined up kind of thing? Tell me more if you're still there. And I'm also happy to talk more tips about certain things. I don't know if I've beaten a dead horse with my program stuff. The MSN, like where to go with graduate level nursing, is a whole nother discussion, which I'm happy to chat about if that is beneficial. But if anyone has any specific like questions about their program or anything like that, let me just get my Spindrift. Do you guys like Spindrift? I love this. All right, I'm not hearing anything, so I think I'm going to start talking master's options. How's that sound? Okay. No job. Okay. Oh, lots of stuff. No job lined up, but I hope to eventually work in a burn unit. What sorts of positions would be manageable while in a BSN program? Okay, great question. So a lot of this depends on personality and things. Caveat, as a new graduate, I would not have worked well in an ICU environment. I worked in the ICU after 2 years. It was a neurocritical care unit, but I worked at a med-surg level of care. It was specific to like cardiac surgery, but it was med-surg level of care. And there's another question from Gizmo. Hold on, let me do this one and then I'll do that one. Do you think patients treat me? Okay, short answer, no. For the most part. But and how difficult was the master's program compared to the BSN? Were you working while you're going math? What wonderful questions, people. Okay, so positions that would be manageable in a BSN program. So what I would do, and what a lot of people in nursing schools do, is they feel like they need to get a job in the highest acuity possible, meaning I need to work in the emergency department and I need to work in the ICU or the NICU or whatever. Like those are like the sexy, like, oh, I'm like super cool and super smart because I can work with the ICU patients, which is great if people can do that. Now, working in the ICU as a new grad is very challenging. I mean, just starting off as a new grad in the hospital is very challenging. Okay. New grad in an ICU critical care environment, you're like learning you're building the plane while you're flying it kind of thing. Like patients have certain expectations. you're brand new, you're learning how to be a nurse and take care of people who are dying. It's a lot to put together at the same time. Like you're really learning on the fly. And I've seen, nurses start in those units and then decide, hey, this is not okay for me. It's just too stressful. And they're not going through a program. So if you are like, I'm going to get a BSN right away, I would stick to like a med surge level of care or something not, or lower acuity. So that could be an observation unit, that could be a 1-day surgery. If you do 1-day surgery, you will get really good at IVs. 1-day surgery is like people are coming in for surgery, they'll go to that PACU, and then they'll go to recovery, like the post-op area, and then they go home. They don't go into the hospital for the night. So those are for minor surgeries, those kinds of things, like or a procedural area like endoscopy, which is where people get colonoscopies and EGDs and things. Those patients all need IVs. They tend to get IV fluids, IV meds, labs and things drawn. So they're very skill heavy, lots of assessments and a lot of turnover, but it's not like you're assuming care for someone for 12 full hours. So if you're going through a BSN program, I would recommend either doing med surge or a procedural area like 1-day surgery, and they have better hours too. Those are usually a like day situation, unless you want to work nights. Or I would work in like a med surge where you're learning how to be a nurse, but most of the patients are not like dying. And the family members are not like really intense, wanting all having pretty reasonable but high expectations. It's kind of a lot of pressure to deal with. So I would stay away from high acuity areas, meaning the critical care units. And that's not to say you could never work in them. That's just saying, hey, let me get my BSN, let me get situated. And then if you want to do ICU, you would be a phenomenal candidate. You got the BSN, you got some good experience, and your orientation would be a lot smoother because you don't have these other things that you're thinking about, like your program and just trying to survive. There. Those are my, an observation. I don't know if you guys know what an observation unit is. It's someone comes to the emergency department. The physician's like, I don't feel comfortable with you going home, but I don't know that you need to be in the hospital, like for real in the hospital. So they'll go to a observation unit. You might hear it called OBS, but it's like the patients are there for like 24 to 36 hours where it's like, okay, maybe we're going to watch them on a telemetry monitor for overnight, and get this test done in the morning and then probably discharge them. And then if the test shows this, then we're going to send them to the cardiac unit. So there's a lot more throughput, meaning patients coming in and leaving, but they're not critically ill patients. Okay. So that might be another good option too, as when you're working on a BSN completion program. All right. Gizmo says, I have 2 years left of my bachelor's. So BS little CN, you're Canadian, right? Because I'm pretty sure that's the Canadian way to say I have, or from Australia. Good questions. Do you think patients treat male patients differently? Yes, Canadian, I was right. Do you think patients treat male, hold on. Do you think patients treat male, do you mean, male nurses differently? So I had the experience that patients took male nurses a little more seriously. Like often it felt like they would think they were the doctor. Um, it kind of depends. Now, if you're going to work in like a women's health unit, they might, and your patients are there for like lady problems. They might be a little hesitant with you, but I don't think that they really treat males that different at all. And yeah, I don't, and the way that I think that the sex differences play out at the bedside are, you can have as a female nurse, some sketchy patients, and they're just trying to flirt with the nurse and it makes them uncomfortable. If you can have the male nurse go in there and take care of whatever need it is, like holding the urinal or something ridiculous that they're trying to get the female nurse to do. Like, or you're also, I don't know if you've seen on TikTok and like Instagram, but like you're going to be helping. Yes, you've had to do that before. Yeah. I mean, people do that kind of stuff and it's very gross, but like that is the reality of working with the public. Okay. And also, you're probably going to be used to lift patients and help people like physically do things, taking more rounds and CPR stuff. And, but in terms of like patients treating the male nurses differently, I really never didn't pick up on that. I worked with a lot of male nurses. Um, and it was always a great, you know, great to have males and females. So I wouldn't be worried at all. There's it's nonstop. I'm always wanting to turn and pull him in bed. I'm sure you are. I am sure you are. Um, okay, I am like 6 feet tall. And I would always work with these Filipino nurses who were like 5 foot nothing. And I would have to help pull up patients a lot. So yeah, actually quick funny story, and then I'm gonna mention or go through the MSN question. So when I was a brand new nurse, I worked nights and I worked with like that night, it was like me, 6 foot me, okay, and my 5 foot nothing Filipino nurses that I loved dearly. And it's dark. I work with geriatrics and, things get confusing at night. And I had to go into a room to help my coworker, who was one of the Filipino nurses, pull up their patient in bed. And he was an elderly white male who was like kind of confused. It's dark in his room, and the only light is in the hallway. And then, so the little Filipino nurse walks in, and then in walks me into the room, like with like bright light behind me, and I must look like this very large presence. And he goes, "Oh my god, I thought you were gonna eat me." I was like, "Oh my god, all right, well, welcome to nursing." Thinks I'm gonna eat him. I'm gonna like monster destroy him, but anyway. Oh wait, okay, hold on. Before I do the MSN, talk about how to handle difficult family members. I had clinical today with a family that was so difficult to satisfy. Oh, yes. I have a podcast episode on this. I think I have a I think I have a blog post on it on my website. If you search just difficult patients, I think I have one on there. Oh, and I have a communication. I'll put links to these when I'm all done. I'll put links to these in the description or the comments. I did like a comprehensive communication guide, and it has like links to those episodes. Um, so yeah, dealing with difficult patients is a very, or with people who are never happy. Um, I like to, so especially if you're in an ICU, or like people had sudden changes, you're going to notice there are people who are very particular, kind of condescending about their preferences. How dare you not know them, kind of thing. Which is very frustrating to do, but you do kind of have to pick your battles and realize, okay, they're being unrealistic. I am not going to make these people happy. So part of it is telling yourself that, how do I want to say this? I don't want you to like feel like I'm only going to doing a good job if they are happy with me, because it sounds like nothing will make them happy. I tend to do things like, wow, that must be really frustrating. I'm so sorry. Like validating first, because a lot of grumpy, rude, difficult patients want to just make sure that they're being heard, and they feel like they're screaming into the abyss and nobody's listening to them, even if there's nothing you can do about it. So validation and acknowledgement of like, wow, that sounds really tough, or I'm so sorry. Like I had one who was like kind of like that, and um, she was telling me about how she had to do CPR on her dad for like 30 minutes until EMS showed up. And just me saying like, wow, that is really tough. I'm so sorry that you had to go through that. um, her whole tone just changed. That someone didn't say, "Well, yeah, got to do what you got to do." It was like, um, "Oh, okay. I just needed someone to tell me I was doing something. I did something that was really hard," and then she really chilled out. Another way, I'm losing it in my head, but out loud, I just agree and try to change the conversation. Yes, so that's good. So like, you can lose it in your mind. But then, diverting the conversation elsewhere, what's going on with my hair, and like distracting it. It really depends on what they're like riled up about. But validation, redirecting. If you have someone who's never satisfied, I also like one time I had a patient that the husband was really mad that the wife didn't have food. She like did not pass a speech eval. It didn't look like she was going to be safe to eat. And so then, the nurse does a screening. The screening comes back, hey, I think speech therapy needs to evaluate if this person can safely eat. Well, she had gone like, I don't know, a while. I can't even remember now how long it was, but longer than he was okay with for her eating. And I knew this. So the first thing I did was, hey, I know that her eating is very important to you. And right now it is 7:15 in the morning. I'm in the middle of getting a report on all my patients. The physical therapy people get here at 8 a.m. I am going to call them at 8:02. And I will let them know how important it is that we are seen first and the priority level. And after I talk to them, I will come back to you and I will tell you what they say. And he was just like, oh, thank gosh. Like that was what he was so worried and anxious and angry about. And to kind of like proactively address that with him, it's like I couldn't fix it for him because I couldn't give her food, or I can't get speech therapy there when they're not there. Like I can't do that. But to say like, hey, I'm trying and I'm doing this and here's when I'm going to come back. Those kind of things can help chill people out. And then also know that there's going to be some of those family members that are just going to be ridiculous. And even if they weren't in the hospital and had things going on, like this is just like a crazy way to act. Like don't I'm not a servant here. So unfortunately there is a degree of that where it's like you just have to write it off, that it's like this is I don't even have the words for you. Okay. Hope that helps answer that question. All right. Question: how difficult was the master's program compared to the BSN program? Were you working while you got your MSN? So I went to Capella and I did the flex path, and I did it in about 18, 19 months. I think I got done. It's a haze because I was pregnant at that time. I graduated in November 2018. Oh, hold on. Yeah, you could tell some people would cut you in half for putting butter on their toast instead of jam. Like, I didn't ask for ice with that ginger ale. It's like, well, it's room temperature, okay? And you know what? Okay, let me back up just a sec to sometimes I like to get playful with these people and be like, "Can oh, I'm sorry, ma'am." Like you have to feel them out, but you can like playfully like, "Oh my goodness, I'm so sorry. I didn't realize," like, "Oh geez, I don't think I'm ever gonna make you happy today, Miss Sarah, am I? I don't think I can get one thing right. Is this okay?" Like some depending on the person and the personality, if you can get sassy back, they kind of like that. But anyways, back to the MSN situation. So I was pregnant and I was working PRN. So, but I was also doing my nurse life blog stuff. So I was doing my Fresh RN blog. I was writing I actually came out with my first Fresh RN course in 2018. So that was the Neuro Nurse Crash Course. So I was working PRN, so one day a week at the hospital, and then I was working on the masters and then also on my maintaining my education business. So I was working, but only PRN at the bedside. If I was not working my regular blog, website, education stuff, I probably would have just done part-time, because when you do those competency-based programs, those are like based off of time. So the faster you work through it, the more cost-effective it is. And I also wanted to get completely done with the program before I had my son, because I did not want to be worrying about assignments while I had a newborn, which I'm glad I didn't do that. So I had like a hard deadline. So I actually like went as hard as I could with getting that done on time, and it was it was doable. There were clinicals that I had to do. Um, it was not awful at all. Now, in terms of the BSN versus MSN, it is a difficult challenge or comparison because the BSN had all the clinicals and it had the NCLEX. So when I did my MSN, I got my MSN in nursing education. There's no board examination for that. That's like I got my degree. I did not get a nurse practitioner degree because you can get an MSN with a nurse practitioner focus, but you would have to pass the nurse practitioner board examination to work as a nurse practitioner. So I didn't have that I had to worry about. Had I done that, I probably would have worked part-time if I didn't have like my nursing business. But yeah, they're two kind of like two different beasts in terms of MSN versus BSN and the type of MSN you're going to go for. So if you're going to go for more of an informatics education, what are the other specialties that are non-NP? I can't remember off the top of my head, but there's multiple MSN focuses that are not nurse practitioner that don't have board examinations afterwards. So that's kind of like one type of MSN. They will have some sort of like practicum environment, but they're not like NP clinicals where you're like working as a provider. Like I did not do that. I do not want to do that. That's not my jam. There's a lot of people who love that. This is not my thing. So doing that at the same time as working, I don't know how someone, I mean, you could do that, but you'd have to be getting in clinical hours and things too. So I think it would be much more feasible to either work PRN or part-time. And they are, yeah, like the MSN for a nurse practitioner versus the BSN. Like I feel like your BSN clinical board examination situation and the MSN is probably quite comparable. When you do an online MSN that does not have boards and is not nurse practitioner, it's much more like BSN completion kind of thing, but harder. Or, just a level up of like complexity of information. And I had also worked as a nurse for 8 years before I started MSN stuff. And I had learned a lot because I did a lot of committees and things. So I was able to work through it kind of faster because I was able to draw on some of the experience I had. All right. Good question. Oh yeah, okay, cool. Someday I would love to do an MSN for education. Yeah, that was my jam. I'm glad I did it. I really like it. And I know like if I wanted, I do this full time with my nursing education business, but if I wanted to go work at a hospital or whatever, like also just having the MSN, like I know you, like I have the specialty in education, but just the fact that there's like this MSN level opens up the job opportunity market. And I think that's important also to know, like I know people who have done the nurse practitioner degree, the MSN, and then they're doing it and they're like, gosh, I don't even know if I want to be a nurse practitioner anymore. This is so hard, or I don't like it anymore, or I don't like the this or that. But at the end of the day, though, you still have a master's. So you're qualified for any nursing role that has minimum requirement of a master's. So while you were getting the NP degree, you still have other options too. So now, granted, I would not start an NP program unless you were 1000% sure you wanted to be an NP, because that's a big commitment in terms of money and time. And it is a very specific job role. Clinical nurse specialist is pretty legit. That's one to think about too. I just interviewed the um, head of the American Association of Clinical Nurse Specialists. Her name was like Mitzi Saunders or something. That's on my podcast. It's also on my, oh, is it on my YouTube? If it's not, it should be. I need to make sure that's on my YouTube because I took video of it. Now I'm thinking I didn't do it or put it on my YouTube. I have so many videos that I forgot to upload. And I've got to go a little bit. But that is a really awesome role to think about. But then, okay, there was a question. Hold on. For us in the US, what are our requirements for applying to do your master's? For Canada, we need 2 years of experience first. Yeah, I think that's her name. So in the United States, I think you just have to have a bachelor's to get into a master's program. You do not need to have experience at the bedside or in a nursing role to start a master's program. You just need to meet the entrance requirements, which are often like graduated with a bachelor's, have an active nursing license. Now, the thing that's like requiring experience is like if you want to sit for a certification exam. So if you wanted to become a certified critical care nurse, you need to log a certain amount of hours in that critical care environment to be eligible to sit for that exam. If that makes sense. Okay, guys, I gotta wind it down because at 2 p.m. I have a call with my all access people. For if I don't know if I have my all access membership where you get access to all of my content, and part of that is weekly live Zoom calls. So I have that at 2 p.m. I go over a lesson plan and then I answer questions, and that starts at 2. So, does anyone else have any last questions or anything before I hop off and give my voice a 30-second break before? um, oh, awesome. I'm glad you like the info. I do have I'm going to do lives next week. I like doing this. Oh, I'm so glad they've been a lifesaver. Woo, woo, woo. I'm gonna I think I'm gonna do this regularly, though, YouTube lives. I'm enjoying this a lot. I have 2 scheduled next week. I have one scheduled on Monday and I have one scheduled on Friday. So if you go to like my YouTube channel and under live, you should be able to see the times and get a notification if you'd like to do it again and bring me questions. And if you have a question, put it in the thing, the comments. So good to see you and so good to chat, everybody. I hope you guys all have a really great day. Bye.